Hello, and welcome to For the Love of Family. My name is Katie, and I am currently studying neuroscience and psychology at Northern Kentucky University. This video is going to be talking about family-based therapy, or FBT, specifically in regards to eating disorders and the treatment of eating disorders. Just a quick disclaimer, I am not a licensed clinician, so if you're watching this video and you have any concerns or questions, I encourage you to please seek professional help or the opinion of a professional. I will provide links down in the description of ways you can find treatment in your area, as well as some more websites that have a bit further information that I'm going to go into in this video. So family-based therapy is also known as the Maudsley method or the Maudsley approach, and this is a home-based treatment approach that has been shown to be effective for adolescents with anorexia and bulimia. Family-based therapy does not focus on the cause of the eating disorder, but instead places initial focus on refeeding and full weight restoration to promote recovery. All family members are consistent and an essential part of treatment, which consists of reestablishing healthy eating, restoring weight, and interrupting compensatory behaviors, returning control of eating back to the adolescents, and focusing on remaining issues. So this is extremely helpful for those who are still living under their parents' household or still have a guardian who takes care of them, but it can also be used with individuals who are in a shared living situation, or even if you're just living with roommates or your significant other. It's still important that this therapy changes the environment, not just the individual. So especially in the cases where an individual might be treated an inpatient, the transition back to home, this is extremely helpful in keeping up their recovery once they are no longer being monitored 24/7. So family-based therapy has a couple different branches. So we have behavioral systems family therapy, conjoined family therapy, family systems therapy, and separate family therapy. So behavioral systems family therapy, parents are coached to help the sufferer restore adequate nutrition and eat regular meals and snacks. It also broadens the focus of treatment to include cognitions and problems in family structure, while the parents are still in charge of the refeeding process. So this could look anything like the family taking nutrition classes together and cooking classes together to have more regular and healthy meals, or anything like preparing snacks together, so you're fixing the family bond together while you're also teaching everybody to have better nutrition. And so fixing the problems of the family structure can look anything like marital problems, or problems between siblings, or problems just between the parent and the child, but it still has the parents at the head of the household. So this is especially helpful when dealing with younger adolescent teenagers. Conjoined family therapy is a therapeutic approach that teaches the entire family, including the eating disorder member, simultaneously. The premise of CFT is the client existing within a family and spends most of their time with them. Focus is on improving family dynamics that may be contributing to maintaining the eating disorder. So just as the last one, this is really focused on changing the entire environment, not just the individual. So the premise of CFT is, while the individual is learning about nutrition, while the individual is going through their refeeding process, the family is there with them. They're both learning how better coping mechanisms, they're both learning how to deal with their negative cognitions, and they're all learning how to have better behavioral systems. So this is extremely beneficial for maybe an older adolescent who is about to be an adult or who has already turned 18 but is still living with the family, because it's a more equal approach where they're all in charge of it together rather than the parents being in charge of the feeding program. Family systems therapy emphasizes family relationships as an important factor in psychological health. Therapy interventions usually focus on relationship patterns and communication rather than analyzing impulses or early experiences that may have contributed to the development of the eating disorder. Family systems therapy is different from family-based therapy in that it focuses on interactions between family members as a way to improve the eating disorder behaviors. This is extremely beneficial in families that may have some problems, whether there's past trauma or just issues, conflicts that have happened between the families that are causing a drastic amount of anxiety on those suffering from the eating disorder. So instead of just focusing on improving the eating disorder, it's really focusing on building and strengthening the relationships, in the thought that if you strengthen the relationships around the person will have a better relationship with themselves, and it will be easier there. So though the family may still do things that help those suffering with the eating disorder improve in that aspect of their life, it really focuses on all of the other aspects rather than just the eating disorder. In separate family therapy, the adolescent is seen on his or her own, and the parents are seen in a separate session by the same therapist. This differs from conjoint family therapy, where the patient and family are seen together. Both are effective, but the separation parallel sessions in SFT are favored in cases where there is a high degree of hostility or parental criticism. This can also be extremely helpful if there are siblings to the individual suffering from an eating disorder, especially if the siblings are rather younger. They may not understand the situation fully and need some cases where they're talked to by somebody who will understand and help them understand. This is also extremely helpful at the beginning. The therapist can decide whether they end up doing conjoined family therapy, but it's a good baseline to start to see if the family is contributing to the stress of the eating disorder and how to avoid that going into the future. So that is the last therapy we are going to cover in this video. If you have any questions, I encourage you to comment them down below, and I will try to respond to them either in another video or by commenting. Also, comment your personal experiences. I would love to hear from people who have gone through these therapies themselves. And yeah, I will see you guys in another video. Thank you for watching.